Welcome back to Daytime, everyone. If you catch a cold or get an ear infection, many people will just take an antibiotic to cure it.
And while antibiotics are supposed to help us, our herbal pharmacist Dave Foreman will tell us why the misuse of many of these drugs is turning them into health threats.
So he's telling us why you should consider being anti-antibiotics in this superbug society. Good to have you back.
Thanks for having me. I appreciate it.
So we shouldn't be taking antibiotics when we get an infection?
It depends. A lot of times antibiotics are overprescribed. Like the common cold, acne. I mean, there's a ton of different health challenges where antibiotics aren't even really warranted.
Right. If you've got a virus, not necessary.
Yeah, well, especially a virus. I mean, it's almost ridiculous if you have a virus, bacteria don't. Antibiotics don't work on a virus, so it's kind of stupid to prescribe them, yet oftentimes doctors do. 50 million plus courses of antibiotics are prescribed each year for reasons we really shouldn't be taking them. And that's leading to these superbugs. I call them turbo bugs. They're bacteria that have mutated.
Yeah, what is it?
Yeah, they're bacteria that have mutated. Because of the use of antibiotics, they've kind of changed the way they were, so now the antibiotic that used to work on them doesn't work anymore. Example, first antibiotic we had was penicillin. How often do you ever hear that prescribed anymore?
Not often.
Not often.
Because it usually doesn't work, because these bacteria have mutated and become superbugs, which are now becoming life-threatening. That would be the main reason, I guess.
All right, then, if we're not going to be popping a pill, what should we be using?
Okay, I brought some examples of conditions where, people are often prescribed antibiotics and don't need them. I brought a little, it looks like a teapot. It's called a neti pot.
Cindy's familiar with it.
I've never tried the neti pot.
This is for people who often get prescribed antibiotics for allergies. Use a neti pot, use a saline water salt solution, rinse out your sinus passages a couple of times a day. You'll reduce the chances of infection.
So you just stick that thing, you put your nose there, and then you do the
over the sink. Yeah, exactly.
Really?
Right. Yeah.
Like just like that?
Well, it's over the sink, so it drains in one side and out the other.
And that helps clear out the allergens?
Right? Yeah, it clears them out. Exactly. So they're not touching your sinus passages, and you don't have that inflammation that often antibiotics get prescribed.
You're familiar with it, but you haven't tried it?
I've tried the saline solution, but I need something stronger. I have some major issues.
Well, I will add herbs to it.
Okay.
Another challenge, this is one of mine when I was a kid, is acne. I use a tea called fluorescence. It helps detoxify the body. You are on the outside of your body what you are on the inside. You get rid of the toxins, eventually the acne clears up. So using that tea on a daily basis is a gentle everyday detox, cleans your system out, cleans up your skin.
I think a lot of people think topicals is the only way to go, but really it's coming from within.
Yeah, yeah. I mean, your skin doesn't grow from the outside in, it grows from the inside out. So you got to clean out your body, and eventually your acne will go away.
But does it help excessive acne?
Yeah,
I mean, really
I've had people with chronic boils for years and years and years using antibiotics. They never work anyway. Just by detoxifying the body 4 to 6 weeks, and then just continue to use it. It's like a daily just detoxification of the body.
And look how beautiful his skin is.
Yeah, he's doing great skin.
I'm 85, right?
Yeah, forget the Botox.
Another example would be chronic or reoccurring urinary tract infections. I know we've talked about urinary tract infections in the past. Using a cranberry supplement like Cranmax, science has shown that it actually can help prevent the reoccurrence of urinary tract infections. So now you don't need the antibiotic. They've even compared Cranmax to antibiotics and shown they work equally as well, and you're not using an antibiotic. It's kind of cool how that works.
And that's a daily thing as well?
Yeah, you just take one little capsule every day.
Is there something like that for bladder infections by any chance?
That's the same exact supplement would be used for bladder infections as well.
Okay.
It's a lot better than using those cranberry juice cocktails. And, you know how I feel like they're CRAP, of course, you know.
Right.
Yeah, exactly. And the last thing I brought as an example, this is a probiotic and more. Probiotics are really good for, if you're chronically getting sick, the cough and cold, whatever, respiratory type infections, you need to do something that supports your immune system. There's an abundance of things available at your local health food store that will support your immune system over the long haul. That's what you'd want to do, take supplements that will support your immune system, not stimulate. If it's too late, you're starting to come down with a cold, then you got to shoot for those echinaceas and the vitamin C high dose and that kind of stuff. But just for those people that kind of are always kind of tired and run down, there's an abundance of supplements you can buy at your local health food store.
Most sicknesses originate in the gut, right?
Exactly. 60% of your immune function, they estimate, originates in your gut. And so by taking good care of it with a probiotic is probably one of the more sound things to do.
And you can clearly take care of it on a daily basis, too.
Yeah, and the cool thing is there's really no side effects. I know the neti pot's a little bit freaky for people, but it works. Trust me, I've done it myself.
All right. Dave Foreman, thank you very much. You can reach Dave through daytimeonline.tv.
All right, just click on his head at the bottom of our page and we can get to him right there. Keep watching Daytime. Our giveaway isn't far away.